All right. I don't know why I have the annotation box open. Okay, so let's get started a little bit. Good morning, everyone. Welcome to the Skilled Nursing Facility Consolidated Billing, jumping into the basics. Skilled Nursing Facility acronym is SNF. Consolidated Billing is simply CB. So SNF CB basics. This course is to help everyone understand when they can bill the SNF versus Medicare. My name is Tom Ryan. I'll be your presenter. I am with Provider Outreach and Education at WPS. I'm joined by Ashley on my team, and her job is to kind of monitor that chat and to make sure that you're getting the questions asked to me, but also to put additional information, links. If you have a question that we need to research, she may have to do that, or she may have to put up our other things going on. So I just want to make sure everyone's aware of what's going on today. Again, questions in the chat, that will help us tremendously. What are we doing today? Today is a new to Medicare course to introduce you to the SNF Consolidated Billing concept. Our goal is to avoid future claims denials and rejections by making sure you are billing correctly up front. So what are we going to do? Well, first I'm going to do a basic overview. I did get some questions. Actually, a couple of you told me you were new to Medicare. This happens every time we do anything related to this topic, so we want to make sure we're getting that. We want to help you try to determine who to bill, and I'll explain that, and then we'll look at the CMS website files. I do want to let you know that I was asked for SNF billing, Skilled Nursing Facility Billing. Consolidated billing is not about what goes on a claim form to get the SNF bill to Medicare. That's a different course. This course is about working together to make sure that you have everything you need before you prep the claim form to come to Medicare. And it is about outside providers, outside of the SNF, billing them or billing Medicare or the patient. So there's a lot going on, and it's not going to be about directly billing the SNF. We're not going to talk about how to fill out a claim form or anything like that. If you want those courses, however, we do have a playlist on our website. I'm going to ask Ashley if she'd be willing to jump out onto YouTube and see if she can find the Skilled Nursing Facility playlist and put that in the chat for you. All right, so let's move on a little bit about the overview. The overview is designed to answer, again, those basic questions. For the people that are new, please pay attention to this part and ask questions as you go. If I lose you and somehow during the overview, you are not going to get anything out of the rest of this, and I don't want that to happen. So I really need you to put questions in and make sure that you have an understanding of what's going on. By the way, thank you for those that are new to Medicare and are joining it and really are just looking for that information. Thanks also to those that just want the review and they just want some general information on this. This is a little bit of a complex topic. Well, it's a little bit. It's a very complex topic. So what is Skilled Nursing Facility Consolidated Billing, or SNF CB? This is a bundling concept in which the SNF is responsible for most care. The key thing is most care, not all care. And what CMS says is if it's outside the scope of a skilled nursing facility's practice, in other words, they don't normally do that or they can't possibly do that, that's the care that is not part of the bundle. It's separately payable. And so how do we know what that is? Oh, wait, that's what we're going to get into throughout this course, especially because there are files based on procedure codes. So what does this bundle incorporate? What it does is says the SNF will receive a one-time payment, a per diem based payment. And yes, I understand that's a very simple explanation for this. So don't say, oh my gosh, that's not really it. There's more that goes into it. I get that. But for a basic definition, it's a 1 day per diem payment. And each day gives them a certain level based on a prospective payment system. And that prospective payment system takes a variety of things into account. Now, we're not going to get into SNF payments and things like that. What we are talking about is, should this bill go to the SNF? Should this bill go to Medicare? Or should this bill go to the patient? That's what consolidated billing is. Is it inside the bundle, outside the bundle, or not even considered by Medicare? Let's move on a little bit. Oops, I apologize for that. Um, Somebody asked, why was consolidated billing put into place? The basic goal was to enhance overall care by the skilled nursing facility or the SNF. The SNF then should know what's going on with the patients who are inpatient at their facility. Because part of the SNF benefit is that a patient may leave during the day. They don't have to necessarily be there at midnight. They may also have a leave of absence to check and make sure they're safe to go home. Are they ready to go home? All of those types of things. They can also have a leave of absence or a stay where they're not in for holidays, for funerals. So there's a variety of factors that play into that. So then what they also went on to say is by doing this bundling and enhancing the overall care, it also lessens the patient's out of pocket. And this is true in that you have the SNF benefit versus the SNF benefit being paid for the facility plus the Part B deductibles and co-insurances, which is the 20%, all of that. Now, there are still services that will be applicable to that, but it's to kind of lessen that so that not everything is going to that. It also then eliminates double billing. Should the SNF do this, and this is part of what they're there for, why are we having an outside provider bill Medicare for that service? Now, we'll talk about that in just a little bit when we get to a couple of the different files. So that's what it was designed for. I do want to give you another definition, and this is the two types of skilled nursing facility stays. So the SNF stays. First, SNF stays are divided into Part A stays and Part B stays. A Part A stay is when Medicare is covering the inpatient stay. Examples of what that means. We're paying for room and board, we're paying for nursing care, we're paying for all of those types of things. This is only 100 days in a benefit period. I'll define the benefit period in just a moment. A Part B stay says Medicare is not covering the room and board, but will still pay for items that would be covered under Medicare Part B. Now, Medicare Part B is for outpatient care and is regardless of certain settings. Now, you do have to put a place of service, and we're not going to get into all of that. But it is something that is the patient may be inpatient. However, that 100 days is used up. They may be inpatient. However, they didn't meet the coverage criteria. So whatever's going on, or for whatever reason, this patient is not within that Part A stay, is not being covered by Medicare. Okay. Now you heard me say a benefit period. A benefit period is the number of days that a patient is inpatient in a medically necessary stay. A benefit period does have benefit days, Part A days, which we talked about here what that is, but it also contains Part B days. Remember, it's a total number of days. This means that the patient stays inpatient for as many days as needed without a 60-day lapse in inpatient care. So I took a little bit of a breather to kind of let you guys write that down. But essentially, a benefit period means that a patient is remaining in a medically necessary inpatient stay, regardless of whether Medicare is paying or not, for as many days as needed without a 60 consecutive day gap in any inpatient care. One of the questions that came up with benefit period as an example is, does it have to be a related diagnosis? And the answer is no. That's not what CMS says about a benefit period. So any inpatient care at all. So lots of things going on with that. So we want to talk more about that as we get a little bit further in. Now, we do have some SNF payment responsibilities and who's going to pay where. So when we look at the SNF payment responsibilities, if it is a covered Medicare stay, let's put that in first. It's not just that they're in an inpatient stay, it has to be a covered inpatient stay by Medicare. Then there are certain services that are automatically part of that stay. One, clinical social worker services. This is an expectation that these services being done at the facility are billed as part of the stay. Incident to services, always going to be billed as part of the stay. Preventive and screening services. It's an expectation that the SNF provides them and they are billed by the SNF, though they are paid outside of the prospective payment system. It's a separate payment for that. Also, it says Medicare covered services. That is the area that we have to look at closely when we get a bit further, because Medicare covered services means it has to be part of the skilled nursing facility's ability to do that service. And there are things that are not part of it. So major surgeries would be an example. We don't expect a skilled nursing facility to have an operating room or OR available for an appendectomy. It's not an expectation that Medicare has. So that would be an example. Then we have what are called Part B stays. And there are 3 services that are only billable by the SNF in a Part B stay. And these are outpatient rehabilitation services, which is physical therapy, occupational therapy, and speech language pathology. The reason that these 3 services are only billable by the skilled nursing facility is because this is what a medically necessary skilled nursing facility stay is designed to provide. So if they even come to an outside provider, we still need that bill back to the SNF. The SNF then has to bill that back. Okay. So when we talk about Part A and Part B stays, that's what we're looking at. Now, it doesn't mean that in a Part B stay, the SNF can't bill for Part B services provided. Sure, they can. It just means an outside provider does not need to bill the SNF, with the exception of the rehabilitation therapies mentioned here. Okay. I was asked for this definition, and I think the confusion came in from the person, and I get asked this question a lot, first of all, but I think the confusion comes in when we say Medicare excluded services versus CB excluded services. Medicare means under no circumstances is this service covered under Medicare. That service is excluded in some way under the law, therefore it is always the patient responsibility. I will not be going in depth into excluded Medicare services. That's a benefit and coverage class. It's not applicable to this because you would never bill these services to the SNF. The SNF can't bill them to Medicare any more than you can. Now, these services again are billable to the patient because just like any other excluded service, any other exclusion under an insurance policy, who pays for that when they elect to have it? The answer is the patient does. Who's ever having that service. This is the same thing here. Unlike SNF CB excluded services, these are services that are deemed to be beyond the scope of a SNF, which means they are not part of the bundle. Doesn't mean that they're not covered by Medicare. On the other hand, it means should be billed by the performing provider to Medicare. So bill those directly. We'll get more into that as we go through, but I wanted to make sure everyone was aware of that. All right. So who do I bill? That's the question, and that's the key to understanding SNF CB. First, we talked about this just briefly just a couple seconds ago. The first item or the person that you may bill is the patient. So you need to determine, one, does coverage exist? Period. Are the coverage criteria met? So is it an excluded service? One of the commonly missed items with excluded services are frequency limits or program requirements, such as no 3-day qualifying stay for a skilled nursing facility. Because these are coverage criteria as set forth, then they are billable to the patient when this happens. Also, if the Medicare does that, there are times when it's not medically necessary. So it could be medically necessary for Fred today because Fred's diagnosis says, yes, it's medically necessary. This would be an example of an x-ray on an ankle because Fred tripped and fell and his ankle's swollen. Okay, well, you want to find out what's going on, right? On the other hand, would that same exact x-ray be covered for Fred if he tripped and fell and his hip was having issues and hurting? Probably not if he's not showing any signs or symptoms. Now, we do say probably because there's always exceptions. There's always reasons that you start to look at the hip and you begin to discover that really part of the issue is the gait, and the gait is causing some of the issues, but the gait's happening because he's avoiding it, putting pressure on the ankle, all right? Oh my gosh, there's a lot of medical necessity stuff that goes into this. Okay. One of the other items that's never covered that will automatically be billed is patient comfort items. The example from this one was that the patient is in a skilled nursing facility and they're requesting a fan. This is not a durable medical equipment. It's not a necessity for this patient. So therefore it's considered a personal comfort item. These are things that again will automatically be billed to the patient. Now we have to look at the type of stay and to determine whether or not it is part of the SNF's scope of care. This is for the Part A stays. So Medicare is paying the skilled nursing facility for the room and board, for the nursing care, for all of those types of things. First, it has to be within the scope of care. And this is all established under the law. And then CMS sets forth the guidance on their website in a set of files. And there are 5 different files that we'll look at in just a few moments. Before you bill Medicare as any type of provider or representative, including the SNF, it's your responsibility to determine what services should be billed to Medicare, billed to the patient, or billed to the SNF if they're in a Part A stay. Otherwise, it's billed to Medicare or just the SNF. Now, some of the issues that we see come up, technical and professional components not being separated for a certain type of service, and we'll talk more about that, or associated to a service. A good example of that is an ambulance run. How do you get the person to have an MRI if you can't get them there? That is an associated service to the MRI. If they're in a Part A stay, that is an associated service, and you have to check to see if the MRI is billable separately. That's the associated service. If they're in a Part B stay, there's very few that are billable to the SNF, and we talked about this. It's those outpatient rehabilitation services. Everything else that is medically necessary and meets the Medicare coverage criteria must be billed to the Part B. Well, that's just Medicare. That's your normal billing, follow the normal guidelines. It doesn't change anything. Hopefully that one makes sense. Now, the last thing that you're looking at is, how do I know what types of services automatically come to Medicare because they are what they are? Well, first, most services paid under the Medicare physician fee schedule, most professional components of a service that has a professional and technical, most emergency room services. Why do we say most in the case of an emergency room? If that emergency room is not billed as such, and there's a revenue code that represents this on the Part A claim, then the services associated to that fall into a different category. Now, what types of services could be associated to that ER visit? How about an X-ray? How about a diagnostic test? See, so there's a variety of things that happen depending on what's going on there. There are services that are straight out outside the scope of a SNF. We'll look at those. Any Medicare excluded services, if requested by the patient, must be billed to Medicare. Don't bill the SNF, bill to Medicare. Now, again, you did catch the part where I said must be, or not must be, but if the patient requests it, excluded services, because of what they are, Medicare excluded services by law do not need to be billed. However, if the patient says bill that, then by law they have to be billed. You can bill them, you can always bill them, that's fine, but just don't bill them to the SNF. Also bill directly to Medicare telehealth originating site fees for facilities. So here comes the big section, which is where I'm going to switch over and I'm going to do a little bit of navigation. The navigation will be live on the website. It's going to walk you through some of the different steps in the files you have to use. Now you have slides 15, 16, 17, and 18 to get you some more information. I'll come back to the slide deck after we do the live navigation. Okay. So let's leave this slide deck and again, go to the website. What are we looking at, or where do we want to go to find these excluded services? Remember, this is the SNF CB excluded services. So start off going to Medicare because you're on cms.gov. This is a federal website. This gives you your guidance. Um, this gives you your information based on what the federal government wants. So we're going to go to Medicare. Under Medicare, look through the options on the left side, and I need you to go to coding and billing. Now you notice I stopped at coverage because this is where people commonly go. When you're in coding and billing, you're talking about skilled nursing facility, or SNF CB consolidated billing. That is on the right area, the right side of the body, and then you're going to see consolidated billing. Oh, okay, there it went. Sorry. So this is where you're going to come, and this is going to give you a basic overview of what we just went through. Talks about the laws that are effective and all of that type of information. This is just in the body. And so there's a lot of good information should you want this information. Okay. Um, Other classes will teach you how to use different sections of the website, such as the agreements and things like that. We're not going to get really into that, a little bit more in depth about this. But I do want to point out some items. First, on the left navigational area, which is just a column, you will see the first one is the 2026 Part B MAC update. I'm going to scroll down because you're going to have a second one, which is the 2026 Part A MAC update. I'm going to start with the Part A. And the reason I'm going to start with the Part A is because that's what comes first, right? The Part A files are the ones that we talked about that have to be billed to the skilled nursing facility. So the Part B is the one that comes second. The Part A comes first. Each year, CMS does update this file. That's where you'll see things like changes to CPT codes, changes to HCPCS codes, all of that kind of thing. And that's what this list is. But if you scroll down, and I just want to scroll down to it, you will see a variety of downloads. We were going to look at the first file, which is an unzipped file up here in just a moment. But before we do that, I do want to take a look at the second file, which is the 2026 General Explanation for Consolidated Billing PDF. This is a PDF, and it's the second file under downloads. This one is key to understanding the Excel file, which we will come to in just a moment. And the reason that it's key to understanding is it explains all of the different major categories. So within the Excel file, there are major categories, and on top of the major categories, there are subcategories. But you want to start off reading, for instance, in major category 1, these are excluded beyond the scope of a SNF. Great. So you would say, oh, they're automatically billable to the SNF. You would be half right because you didn't read the full explanation here that says in order to be excluded, they have to be done in a certain place of service. That is a hospital, including a critical access hospital. What does that mean? So for instance, we know that an MRI is going to be in here. So if you go to a freestanding center, radiology center, or you go to an MRI, it's a mobile MRI unit, this is included with the SNF bill. However, if you went to a hospital to have this done, this would be excluded and billable directly to Medicare. That's why it's important to read different things like this. Then we can move down and we want to read a little bit more about these subcategories. Seems pretty good. This is an exclusion list, exclusion list. Great, great. Then we hit this subcategory. And you're like, wait, why is outpatient related an inclusion list? And CMS goes on to explain, hey, the inclusion list that a SNF can do for surgical procedures, because they can do a lot of minor surgical procedures, but not a lot of majors and the other ones. Okay, hold on. This is gonna be so much smaller if we just stick the inclusion list in there. And that's literally what they did. So we'll take a look at that. Here's the emergency services. And here's where I talked about the caveat that it has to be billed in a certain manner to be considered. So if your hospital is not billing this with revenue code 045X, for those that don't understand that, this is something that has to be on the hospital claim. If it's not there, then it's not considered an emergency service. We go on a little bit further and we read the caveats about ambulance trips and we say, oh, wait, what? So they have to be able to meet the criteria. So for instance, major category 1, is it done in a hospital or critical access hospital? Is it also then related to A through E or G? What? A through E or G? Well, why not F? Well, F was an inclusion list, so therefore it would be included. G is an exclusion list, which is the emergency services. Okay, then we got to go into major category 2A, and we haven't got that far, but we will in just a moment. And then any additional surgeries. Okay, and then this one says these are included additional surgeries not captured with the outpatient surgery codes. Again, you can go through each major category and read about all the different items and services. I'm not going to do that right now because I do want to move on and I want to be able to get through the process. Okay, so if we go back, we now understand some of the major categories, some of the things we have to look at. What we want to do next is look at this list, and this is done by opening up an Excel file. The Excel file is a zipped. So here I've selected it, and you can see I've opened up and saved my zip file, which will open up in Excel. What I want to do is take a look at the Excel file. All right, this is the key thing. It's all procedure code based. Yes, that means you have to be able to determine a procedure code in order to be able to use this file. Yes, that means for an ambulance company, because you're an associated service, which remember we talked about, falls under SNF CB, you must determine the service at the end result to determine whether or not your ambulance run would be excluded. That's in this file. So here we go through and we look at it, and you can pick any procedure code. Somebody just asked for an example of how to easily search a procedure code. If I was to look for any procedure code and I don't want to try to scroll through, and there's a lot of them, we can put a control F right here, and we can say, I can't remember what I just typed in there. So you can pull it up and you can hit find and they'll tell you what it is. Now somebody asked, why are ambulance codes not on here? So this is an ambulance code. This is based in mileage. And if we look it up, it says, oh, it is on here. So I don't know what we were asking about not on here. What we do know is that we do have to go to major category 1H. We then have to read that. That's the major category that says if the patient's in a Part A stay, find out what code is being billed here and does it fall into one of the other major categories. Okay. So ambulance is a little bit different than a lot of other things. I could just use another code that isn't going to be on here, and we're going to use 99213. This is an evaluation and management in an office setting. Is this going to be on this list? Well, no, because it's considered a professional service and it's done in an office setting. So it doesn't apply to skilled nursing facility consolidated billing at all. So again, make sure that you're looking it up. If you're not sure what the exclusion list falls into or what you need to know about that exclusion list, that's the time when you do need to go back and look at that explanation. All right, so that is our major category. That is our Part A billing categories. Next, we're going to move to the next section, which was Part B MAC updates. Now, this is applicable for Part B services or services that are beyond the scope of a SNF. Okay, so we do note that there are a variety of files. It'll tell you add to file 1 all the way down. Okay, so we know that there's going to be more than one file because here's delete from file 2. I'm just scrolling down to the bottom, and I find that there are 4 distinct files. What's great about these files is if you open them and you unzip them, the information that you need will be directly at the top of the file. So it'll tell you and help you out a little bit about what you're looking for here. So for instance, this is file 1. It says skilled nursing facility and supplier codes. Then it says professional services other than interpretation and diagnostic tests. That's going to be in file 2. Beneficiaries in a covered Part A stay. These are not subject to consolidated billing and should be submitted to your Part B Medicare administrative contractor. And these are all the services Medicare says straight out, these are professional services. Again, the Control F will help you find what you're looking for. So I'm not sure if anyone has anything they want me to look up. We can look that up in a minute. Put that in the chat. Now, file 2 is a little different. It does open the same way. This is file 2. And the reason that it's a little different in that it does open in the same manner is that, remember, this is for a specific set of services. What is the specification for that set? It has to have a professional component and a technical component. What this says is you must split bill these services. That means that Medicare can deny when globally billed, but the SNF can also deny when globally billed because you did not split bill them, modifier 26 in TC, and you did not bill it appropriately. So hopefully that makes sense. We get a ton of questions on these particular codes because they're like, well, the SNF is denying them. And my first question is, well, did you bill them with a modifier TC? And they're like, no, the SNF's denying it appropriately. You globally billed. Can't do that with these services. So hopefully that one makes sense. Again, if you are questioning whether or not this can be 26 and TC'd, please make sure that you're using the information. Something that would appear on this list will also appear in the major category 1 area normally. And that tells us that if it's done in a hospital or critical access hospital, it's excluded. So, all right, then you have major category 3, and major category 3 is for ambulance and ambulance alone. The caveat is you have to first determine whether or not the Part A rules of bundling apply. You can't just automatically say, oh, wait, nope, this is automatically dropped to these codes. Well, no, that's not true. Remember, we talked about associated services and an ambulance run being an associated service. Therefore, you have to put the Part A bundling rule in place first. So when we look at the ambulance run, is it to a service that is billable to the skilled nursing facility? Therefore, the associated service would be. On the other hand, if it's something not billable to a skilled nursing facility, then the associated service would not be, which means these would be coded to Medicare. One of the questions we got is that the skilled nursing facility says they cannot bill an ambulance run. Now, I'm assuming what they mean by that is that what they're saying is we cannot put one of these procedure codes on a Part A claim. That's true. I just said it's part of or bundled into an associated service. How do you do that service without taking the patient to that service? So let's use an MRI as an example. The MRI is being done at a traveling MRI or a mobile MRI unit. This is not something that is excluded for Medicare. This is an included service in SNF CB. The ambulance run becomes part of the MRI cost because how did you do the MRI if you didn't get the patient there? So the SNF can't put the revenue code 54X on there. On the other hand, they do have to put the MRI codes and have it that way on their claim. So hopefully that kind of answers that question. And the last of the files that you want to be aware of is just this Part B stay only files. Now remember, we said this is when Medicare Part A is not paying, and that the only thing that is included is rehabilitation services, which Medicare defines as outpatient services. I'm sorry, which Medicare defines as physical therapy, occupational therapy, and speech language pathology services. So these are the codes for those which do need to be billed to which do not need to be billed to Medicare and should be billed to the skilled nursing facility, regardless of whether or not the patient is in a Part A or a Part B stay. Okay, that's what they're in the skilled nursing facility. That's the skilled care they're getting. Okay, so that's your basics information, not super complex or any kind of thing like that, and I want to make that clear. So we want to make sure you're a little bit aware of all of those different files and all of that information. All right, move through this because we already went through all of these slides. little bit more information, and these are some different resources. I did talk about that page, the consolidated billing page. So let me just back up to it. If I go back to the top and I go back to the main page for this, we back arrow to it, we can select it up here on the top. If I scroll down to the bottom, one of the associated pages is called Consolidated Billing. That's a related link. By opening this page up, it talks about all the laws that put this into place, a variety of other good information that you need to help understand when you should and should not submit. Now, as I'm scrolling, you can look away if you don't like my scroll. It just explains what I went through in a little bit of a different manner. Okay. But as we get down towards the bottom, there is a link just above downloads, and it's called best practices. Now the downloads does contain a historic Q&A, still good information. It's not outdated. A lot of people ask about that, and it's not outdated at all. But in the best practices area, there's some good information in that it talks about, the billing relationship, the relationship between the SNF and the external provider, kind of what you need to know. But what CMS did is put together some agreements, and I'm just scrolling down. These agreements are under sample forms. This area called sample forms will explain what each one of them are. Some of them are billing agreements, payment agreements, and other ones are just simple, hey, notifications, bill us for. So make sure that you read through that. These, again, are sample forms. One thing I want to remind you when you talk about consolidated billing for SNFs, talk about that portion of it. If your patient comes in and gives something to the front desk, it needs to be transferred to the back of the house where the billing occurs. We hear a lot of people say, oh, they came in, they gave me this information, this gift. SNF's like, well, we gave them that. No, they were supposed to give it to them. Now, again, we can't control whether the patient or their representative does provide it, but the patient says, yeah, we did that. We handed it to the front desk person at registration, but what did that front desk person do with it? In some cases, we've literally been told, yeah, we just file all that. We don't have time for any of that. Well, by not having time for any of that, it means you may not be billing correctly. If you continue to not bill correctly after having been educated, we enter the word fraud. If you just don't know, we enter the word abuse. So neither one is good. Abuse a lot less, you didn't know, but please make sure that you're following within that information. These agreements are definitely set in place. Another one that goes with these agreements, someone asked, they have some frequent office areas that they get information from or they get people from. And could they have a billing agreement, for how to look things up and things that they are needing from the skilled nursing facility or that the skilled nursing facility needs from them to get the bills paid? Sure, you could. It could be a formal written contract. It could just be an agreement. Hey, we're going to give you a call every month and dig through everything. It's what works best for you and the skilled nursing facility. Now, as a skilled nursing facility, you may say, hey, we see this ambulance service getting used all the time in our area because this is the primary one that we have. So maybe we want an agreement with that ambulance service. Well, that makes sense. Um, so we want to remind everyone about that type of thing. Okay, so agreements are really based on what you want. Now, again, they can be formal written contracts. However, that's not part of what needs to be there. Okay. Um, a couple of other things you want to look at on our website. What do we have available to you? And I was asked about this. I don't have any information built into this, which is why I'm covering it. And it was a pre-submitted question. Let me also state that it was a pre-submitted question. So within the portal user manual, which is where I'm going to go, which is the secure section, you could have a user ID and password. However, I don't. I also can't show this to you because it has PHI and PII, protected health information and personally identifiable information. So I got to use the manual to show this. But inside the manual, I do want to make you aware that there's a download button. You can also go through and look through all the manual sections. What I want to point out is that if you go into eligibility right here, and you do an eligibility check, this will walk you through all of that different pieces of information. As you scroll down, make sure that you're on the eligibility area. And then as you scroll down, you'll see a summary. The summary is just the benefits that are available. So don't get thrown off and be like, well, this says, okay, yep, that makes sense. This is what they have available for that data service. Now, it does give you a variety of pieces of information, but what we're really looking for is the Part A deductible information, which follows the summary. And what we're looking for on that is these bottom fields. It does tell us that this has been billed, there's information available for you, and here's what's remaining. The caveat with this, and this is the question that was asked, how does this get updated? It seems as though it's never updated timely. Okay, well, this gets updated through a claim processing. So the skilled nursing facility has to submit a claim. They do not submit claims the same way as outpatient services, any kind. So what I mean by that is if you bill on a 1500 claim form and you have a lab done, or you bill on a 1500 claim form and you're doing something in an office setting, that can be billed later that day, the next day, within a week. All of that is perfectly acceptable. On the other hand, a skilled nursing facility must bill in 30 days increments if the patient remains in for more than 30 days. So if they're only in for 10 days, then they can bill any time after the discharge occurs. And that would be on the 11th through whatever day. However, if they're in for 90 days, they're going to bill on a 30-minute increment. Not 30-minute, 30-day increment. The first 30 days must bill and be processed before day 30 through 60, which must bill and be processed before 60 through 90. So you can see 30-day increments. The key thing I said there is be processed. If something happens with the first 30 days, what happens with the remaining 30 days? Nothing. We won't even consider it because the first 30 has to bill and be processed before the next 30. And it has to be processed to adjudication before it goes to the common working file. This eligibility read is done through the common working file on a HIPAA standard transaction 270-271. That transaction is what brings this information back. So it's not that this information is entered or delayed or anything like that. It is actually the most current we can get. What happens though is you're expecting that a skilled nursing facility bills the same as you do. This question was based on a 1500 biller or an 837P professional biller. They do not. You may see it as a delay in even 60 or 90 days, depending on when that initial claim is adjudicated and processed. Okay, so it's not quite as easy as, yep, it's a day-to-day. With that said, one of the other items that was part of this question is why do we get takebacks? I'm assuming you mean overpayment requests. If I'm wrong, please help me out understand this. An overpayment request or a takeback occurs automatically when a Part A claim processes and adjudicates and a Part B claim during the same time has already processed or adjudicated. It will stop future claims from processing and adjudicating, right? That means that we won't have takebacks because, well, guess what? It's done. We aren't going to do that. That is okay too. However, the thing we need to be aware of is that we will stop all claims processing once we know and once it's in the common working file. Until that time, all of your claims will process because we don't know that they're in a Part A stay. And then once we find out, the system automatically goes back and says, take all of this money back from this provider, take this money back from this provider, leave this claim alone because it does meet the criteria for the skilled nursing facility consolidated billing. These are automated edits, unsolicited responses. I think that looks like the last pre-submitted question. So Ashley, do we have any more questions?
No, we did have one question come into the chat that just asks, is this webinar info for a call that does skilled care?
And it can be, Kathy. I want to make this as clear as possible. Critical access hospitals, Your payment methodology is a little bit different than the PPS, the prospective payment system, but it doesn't mean that skilled nursing facility doesn't apply to you and that consolidated billing doesn't apply to you. So yeah, definitely take a look at that. Though the edits are set up slightly different because the payment methodology is slightly different. Hopefully that makes sense. And that is our only question.
That was it.
All right, I'm going to jump back to the website. I'm going to go to the WPS website a bit more. I'll just take you guys around a little bit and show you a couple of things that might be helpful to you. These are on that resource slide, but if you go to the topic center, or I'm sorry, if you go to the training center, inside the training center, there we go. We scroll down under specialty resources and training. It's way down here. It's the 9th box. So in other words, it's the third column, last box in there. So third box. We open that up. If we scroll down, there is a section for skilled nursing facility consolidated billings. Now keep in mind, we don't want the resources for skilled nursing facilities because that's the one about your billing. This one is about who should be billed or what services should be billed to the skilled nursing facility versus that. So take a look at this. If we open this up, you will see the CMS website links that we showed you. So the exact link to the historic questions. CMS does have an on-demand course and a variety of billing pieces of information. Okay. What does WPS have available for you? We do have a quick reference. I do want to just mention that, and I'm going to go ahead and open this up. I will mention that this is exactly what it says. This is a quick reference. It does not contain all of the detail that the actual files do, but may be helpful to you should you be looking at this. So I don't want you to think, oh, this is everything there is. That's not true, okay? So then again, we go down, we have some information under arrangements for consolidated billing. Again, just a little bit more about who should be billed when, some things you might want to consider and other items like that. And the last one we have down here on the bottom is understanding those major categories. Now we really do like this one because it kind of talks through similar to that as a quick reference and talks to what should be billed. And I do know that if you're looking up here, it says this is for a region. Okay. CMS uses a line of business, which they then have us use on our website. A line of business is divided by Part A and Part B, and also by where you are located in the country. These are called jurisdictions. So, for instance, a Part A line of business means that you bill on a UB04 or an 837I institutional transaction. J5 means you're located in Iowa, Kansas, Missouri, Nebraska, or the rest of the nation, depending on the service. There's 2 states that are excluded from that, and that's Indiana and Michigan. So people that bill on a UB04 or an 837I in Indiana and Michigan, you are J8 Part A. Then you've got J5 Part B, and this is people that bill on a 1500 or an 837P in Iowa, Kansas, Missouri, Nebraska. Same thing for Indiana and Michigan, which is J8 Part B. Now we do have some confusion over this because I say I am a skilled nursing facility. I'm billing a Part B service. Therefore, I think it's a benefit category. That's not how our website is laid out because CMS says we have to lay it out by line of business. That's the way that we do it, and that's what a line of business is versus a benefit category. So please don't get confused by any of that. Let's go ahead and move to the Part B. If you want to find any of these on their own, easiest way to do that is to come to Topic Center, go to Benefits, or go to Claims. For the most part, consolidated billing will be in Claims. And you can come out and look up consolidated billing and find your quick references and under arrangements. Okay, these are just 2 that are applicable to Part B. How do I know that? Because that's the section I'm in. So Part B, line of business. So when you're really looking for different resources, we do offer you a variety of things, but please remember it is ultimately your responsibility. I want to remind everybody, and I'm just going to show this to you because we have had a couple of questions. WPS does have a YouTube channel. WPS Government Services is what you'll search for. All of our encores, which would include this presentation, are then posted to this YouTube channel. I tell you, don't try to go through our entire video list. It's way too long for me. I like to do the playlist. So it'll first be up here when we first load them, possibly, or it's going to use some data-driven stuff. I just recommend going to your playlist. A couple of playlists you might want to take a look at. You can use the search. You can look at SNF or Skilled. Oops, if you spell it correctly, you can look at that one. And when you look at that, you'll see there's just a few of them that come up right away. Here's some skilled nursing facility. Here's some skilled nursing facility. This playlist is consolidated billing. Okay. And if you just look through the different ones, it'll have a variety of webinars. This playlist is just for billing in general, not consolidated billing. So I do think it's important to make sure you look at that. Okay. You could also type Encore because we do have an Encore presentation playlist. Now, the reason that some people don't like our Encore presentation playlist is that it's very long. There's hundreds of Encore presentations because we do many a month. So just make sure that, when you go to view it, you can view whatever you want there. All right, I know I talked a lot more, but I want to make sure from Ashley that we don't have any more questions. Anything else entered in the chat?
The only other question we had, Tom, was asking if this would be recorded, and I did include a link to the Encore presentations page on our website, and I know you just showed our YouTube channel as well, and that was all we had.
All right, perfect. And so this is the question. Oops, I already went through that one. Sorry. I built that question into the slide deck and I already went through it. So our next item up for y'all is to finish some closeout comments. Again, if you would like to, or we would really like you to take our survey. This is an important part of our process so that we know what we did well. Did you like this education? Do you like WPS as an overall claims processor? What can we do better, but also what can the education do better? You also get the opportunity to grade me. So please just take a minute, take the survey, help me understand what you'd like to do. If you haven't taken the survey in a while, please know that CMS has adjusted the survey. It is a bit shorter and you will be asked to take additional questions at the end. That is your option should you want to do that or not, but they really were trying to be time saving when they did that. How can you take the survey? Ashley just put a link in the chat. We're going to give you a box that looks like this, which is your external link box. When we close out, that'll be continued. You're going to get a picture that looks like this at the end of all of our encores, and you will see the picture says online survey. Key for this is if you select it, you'll open up a box and you'll be able to take the survey from there. So really nicely done that way. Also want to remind you that you will get a thank you for attending email in just a few moments. That thank you for attending email does contain a link to the survey, but it also contains your certificate of achievement, so don't just delete it. The certificate of achievement contains contact hours. Contact hours are used to translate to continuing education units. We don't offer continuing education units, that's governing bodies. So use this certificate, save it, do whatever you need to do. If you don't get that, please go ahead and move on. Go ahead and send us an email. The email can come in for the next 7 days, and this is any follow-up question. And this is to wps.gha.education@wpsic.com. Put SNF CB basics in the subject line. If you are sending in something for a certificate because you called in, please put the full 10-digit number in there. We need that to verify. If not, ask your question. Tell us what you're looking for. Tell us what we can do for you. All right. So I saw a question come in and I just want to jump back to the files. Now the files that I'm opening, oops, that's the Part A file, sorry. We want to jump back to the major category file, which I already have open, so give me 1 second here. Here we go, and they said is major category 5 not included. Major category 5 is right here. It says an inclusion list. It does not go through the codes. Why doesn't it go through the codes? Anyone know this? Because these codes are included on the annual therapy updates. They're also included in major category, they're also included in file 4. on the other list, which is the inclusion list. So if you're looking for those, yes, we know that major category 5 are the therapy codes that always must be billed. What CMS is saying is anything on these file updates have to be inclusions. If you want to know that, you can also go to go to file 4 in the Part B world. Okay. So hopefully that then helps you understand a little bit about what they're doing. CMS was trying to shorten this list when they added this because they already have a list of therapy codes. Hopefully that explains it all. That looks like our last question, so I'll go ahead and wrap up and say thanks for attending. Ashley and I appreciate your participation today and your questions. We hope that you'll take our survey and give us further feedback. So on behalf of myself and Ashley, all of Provider Outreach and Education, thanks for participating, and you may now disconnect.